Welcome back to another episode of Questions with Crocker with me, Dr. Crocker, and my husband, Shane.
I'm here.
Good morning.
Good morning.
It is early in the morning. We are getting this done for the week. We should have done it yesterday, but instead decided to go on a date night and watch a movie.
Yes, that was more important.
What do we see?
We saw Twister.
And?
It was good.
It was good. I mean, Glenn Powell is no slack to look at, and I don't know, it took me back to the OG Twister movie.
It reminded me why we have a tornado shelter at our house.
Yes. I was really, when we got in the car, I said, well, if you live in Oklahoma, this is not like a great advertisement for you, because it was terrifying. And it was interesting because there was kids in the movie theater and our daughter wanted to go, but she already is a little scared of like really loud noises and storms. And I'm glad we didn't take her.
Might have been a little too intense for her.
I think it would have been really intense for her and maybe heightened some of her
anxiety.
I don't
know what the word is.
Yes, when it comes to storms. So that was a good call, but good movie. Anyone who is thinking about seeing it should definitely see it. And this is not a paid promotion. However, if anyone wants to pay us to go watch movies,
we'll take that.
We'd be all about it. Okay, so a little bit more about us. This is a podcast based off of your questions you submit, usually online through social media. We have social media handles at Questions with Crocker on TikTok, Instagram. We're on Facebook, and we have a YouTube channel where you can watch our podcast live. Most people probably listen to us in the car, which is probably better when we're barely awake in the morning.
Very true. But you can see our dog destroy stuff if you watch on YouTube.
You can, or our kids interrupt us because This is our real life. So I'm an emergency veterinarian, and I also own a vet hospital, and Shane is an entrepreneur, has a finance background. So we talk a little bit about business in veterinary medicine, being married in veterinary medicine, general pet issues, cases. What else do we talk about?
I don't know. Random stuff.
Really,
talk in circles a lot.
Whatever's going on.
Yes.
I don't feel like we talk in circles. I feel like maybe you talk in circles and then I wrap it up at the very end.
There's probably truth to that.
So you could listen to like the beginning of the podcast and the end of the podcast.
And you're good.
And get all the information. Just a reminder, we are not experts in anything. Everything that we talk about is just based off of our general knowledge and experiences. So what has been your experience these days? You've had a nice couple of weeks with relaxing after the renovation a little bit, but you also are running some other businesses and there's been a fair amount going on. So how are you feeling like anxiety-wise on a scale of 1 to 10?
I don't really get anxious. There's always tomorrow.
Stress level 1 to 10.
I don't really get stressed either.
I mean, I feel like I thrive off of a little bit of pressure. That's why I'm an emergency veterinarian, but I have had a really nice, relaxing 2 weeks. I intentionally set aside time to take days off to school shop with my kids, to get haircuts.
I have anxiety about that, actually. The credit card bill. There's where I get anxious.
We do spend a little bit of money at the beginning of your kids grew. Your son, we get hand-me-downs, so he never gets clothes bought for him really, but we did buy him cool new shoes. But your daughter legitimately has grown so much, and she grew out of all her pants. Her pants were like 3 inches too short. You can't go to middle school with your pants 3 inches too short.
You can establish a new look. Set trends.
That's the style that you're going to have her go? No, we're not going to do that to her. So plus we're entering the world of middle school athletics, which if you're in Texas is literally like the draft. It's next level. So just preparing for all that and for school to start. Usually in the vet hospital, in general practice, things slow down at the beginning of the year because people are going back to school. They have last minute vacations. They really don't want to spend a lot of extra money.
Beginning of the school year.
Yes. Okay. But we're about to be back at school.
You said beginning of the year and I was really confused for a second.
Yeah. Sorry. Beginning of the school year.
I don't always know what day it is, but I know we're not in January.
When you're a parent, you calculate things based off school time. So beginning of the school year.
I'm only doing math using Starbucks.
What does that mean?
All your math is around Starbucks
with
math.
Points and double points. And no, that's called girl math. And that's okay. That's legit. So anyways, we answer your questions. And today we're actually going to answer like 2 different questions because I felt like one was kind of a short and sweet, interesting one. And then the other one is maybe a little bit more in depth. But back to my point of I feel a little more rested than I have been, which is great and needed, but I'm about to start overnights in the ER again. So
We're going on vacation like a week.
We do. We go on vacation in 2 weeks while our kids are at camp. So just you and me. And the biggest thing is this is not a work related trip. So I feel like we go on a lot of trips together, but the last time we went on one that wasn't work related, when would you say that was?
I don't know.
Maybe in Nashville, but that was a couple years ago.
Probably.
Yeah. So very excited to go. If anyone is from Bozeman, Montana and has any great recommendations for food or spas or hot springs or anything to do, we really have made minimal plans because we just want to go and relax and enjoy our time.
I think we have plane tickets and a hotel. That's about it.
That's what we need.
Yeah.
And the rest of it, we'll figure it out along the way. That's how we vacate. That's how the Crockers vacation. There's not a list. There's not a set plan. When we're legitimately going on vacation, we like to be as relaxed as possible.
We do book food usually.
Well, that's because we're foodies and we really
True.
enjoy food experiences. So, all right. So let's get into it. We have a couple different questions, and one of them at Fergus Alonso wanted to know, what is the treatment for chocolate toxicity or chocolate ingestion 3 days after it's been eaten?
3 days, probably nothing.
So
either it's alive or not. I'm not a vet. Scratch that. I'm not a vet. Let's let the vet answer this.
Well, actually, I mean,
you put the little drops in their eye and make them throw up, but you do that immediately.
When I was reading this question, I was like, oh, chocolate poisoning, chocolate. And then I got to the 3 days and I was like, hold up, stop. Because, I mean, you're going to see with something like chocolate symptoms within 2 hours of ingestion. Now, with chocolate toxicity, it's very dependent on what they ingest and how big they are. Do you know why that is?
I'm sure it's like anything else. You can OD based on weight and size, right?
Yes, but think about chocolate.
It expands. I don't know.
There's different types of chocolate.
Got it.
So if they ingest like a certain amount of milk chocolate, it's much less significant than if they
milk
ingest
chocolate's
like
better.
dark. Milk chocolate is the worst.
No.
Dark chocolate forever, for life. No. But if they ingest like dark chocolate, semi-sweet, the ones that are like mainly cocoa, or I had a dog recently, a pug that ingested the actual like chocolate cocoa beans, it can be much more significant. So if your dog ingested chocolate 3 days ago and they're fine and they're not showing any major issues, you're probably good. Now, if they're still having like some loose stool, because there's different stages of ingestion, right? So with chocolate ingestion, you most often will maybe see like an upset tummy if you don't get any sort of care, which I do recommend you call poison control or you be seen at an emergency facility. But if you don't get care and it's just a small amount, then like upset tummy, vomiting maybe, diarrhea, nothing major. But with chocolate toxicity, the pug that I saw that had eaten the cocoa beans was actually having severe muscle tremors. It'll cause heart arrhythmias, so it'll cause tachycardia, so really high heart rate. And that dog had to be on a lidocaine CRI to try to control that side effect. It had to be on muscle relaxer injections. And what it can do is progress into seizures and death over time. So that owner, fortunately, as soon as the dog ingested the cocoa beans, brought him in, we were able to induce vomiting with, yes, the eye drops that cause you to throw up. And we got a ton of cocoa beans out. But certain things are really quickly absorbed into the system. So you have to also like decontaminate, monitor, and kind of keep treating for those side effects. So I think we hospitalized that dog for a day and a half because it continued to have muscle tremors and had ingested like a very large amount. But it is interesting how, sometimes you'll have a dog eat a ton of something and never have an issue. And that will get people feeling like really safe and confident that they'll probably be okay. But all it takes is one time with the wrong thing at the right amount, and they definitely can die from it. So that's why usually when you call the emergency room, even though people don't like it, we'll recommend you call poison control, because if you can tell them the specific type of chocolate, how big your pet is, or we can tell them that, they can calculate all the things and tell us, like, this is what we should expect, this is how long it will last for, and this is how aggressive we need to be with treatment. And the other flip side of that is you might spend, I think it's $80 to call, but poison control might tell you, hey, your dog is an 80-pound lab and it ate one little Hershey kiss, it's going to be fine. Don't go to the emergency room at all. So I tell people sometimes that investment in calling poison control can actually save you a visit to the ER. So to me, it's definitely worth it. But something like semi-sweet chocolate, cocoa beans, those bars that are mainly that you cook with that are like mainly the straight cocoa, you should go to the emergency vet right away.
It tastes like dust.
Yes. I don't know why. It's good probably when it's like in things, don't you think?
I don't know.
Our son doesn't like chocolate. This is an aside, but I'm like, genetically, how are you related to us?
So he says.
Because I feel like you and I like
Right
sweets.
now he likes ice cream and waffles.
That is
and
the
cereal.
staple of his diet.
Yeah.
Yes. Chicken noodle soup.
Yes.
And fruit. Let's not act like we don't feed him anything other than those things. Okay, so hopefully that answers the question. If your dog has ingested chocolate 3 days ago and it's fine and it's doing okay now, there's not much to do. But if your pet ingests chocolate, you should call pet poison control or just head to the emergency room, because the more you get out of them, the better. And they can develop really significant symptoms. There's one more thing. Certain toxins can be bound by something called intralipids. So it's what you give IV, and it's like lipids, and it actually will attach to the toxin. And I'm trying to remember. I feel like maybe we gave this dog intralipids, but I don't want to lie about it. But that is another treatment for toxicity, is if you go to a specialty center, emergency center, they have intralipids. So if your pet is experiencing like an extreme ingestion of something, then going to a specialty center would be recommended. I've seen dogs be like comatose, and we've given them intralipids, and they have recovered really, really quickly. So it's a really important treatment to be aware of, but not every place will have it or carry it. So we certainly do.
Alta Animal Hospital probably doesn't.
Does not. No, our GP does not. Do not come see me at Alta and expect that. So if your dog is having muscle tremors, go to the emergency facility. Don't go to your GP for something like that. Because this dog had to be on a continuous ECG monitor because of its heart for a day and a half. And so that's something that can't be done at every facility. It needs to be monitored really, really closely. So, all right. Any other questions about chocolate ingestion?
Nope.
You feel
Stick
like...
with my milk chocolate.
Are you ready to... Team dark chocolate. All right. You feel like you want to go work at the ER and treat some toxicities?
I feel like our dog has a toxicity right now. What is that noise he's making?
He's licking himself. His foot. I'll check it out in a little bit. It's like the cobbler's shoes. Like, unless he's like losing hair and it's really bad, I'm like, oh, he's fine. Because Ranger, I know. You're okay. Let's stop. I'll check your foot in a minute. I know. Now you got him all worked up. Now he's going to be all over us for the next couple of minutes. All right, let's get to our second question. So, go lay down. Please. Thank you. Our second question I thought was an interesting one, and actually one that I have talked about and debated this like with my friends in veterinary medicine and other people before. So at Candace Avery asked, which is harder, veterinary medicine or pediatric medicine?
What is harder?
Mm-hmm. That was the question. So what's your initial thoughts on it? I'll drink my coffee.
I think they're very different. Even with pediatrics, you still have a person that's talking on behalf of I guess it's the same concept. I don't know.
So let's define.
I guess they're the same.
For me, pediatrics is younger kids. I think pediatric medicine actually goes all the way up to like
18 probably.
Right? Yeah. But I automatically think of like little kids, babies. So for me, I was like, it's very similar because your patient can't talk to you. They can't tell you where it hurts, what's wrong, if they ate something, what's going on with them. And you can't really explain to them what you're going to do. So I felt like right off the bat, it's actually much more similar than maybe like
their bites probably don't hurt as bad.
No, their bites don't hurt as bad.
Or as bacteria ridden.
Yes, you're not going to get as bad of an infection if you get bit by a kid. So it's actually interesting because when our son he was maybe 6 months old, 7 months old. No, I think he was younger than that. He was at the age as a baby when if they got a fever, it was a really big deal. And you needed to figure out like what was going on with the fever. And so I actually had to go to the children's like specialty center emergency room And they put us in a special room because of how young he was. And it was only with like really young babies. And I remember how terrified and helpless I felt. And on top of that, to figure out what was going on with him, they needed to do like full labs, do urinalysis, do some of the things that we would do in pets. And obviously in animals, we had to restrain a lot of pets to get samples. But I don't think it had computed to me that like you have to do the same thing with little kids and especially babies because they have no clue what's going on. And so to sit there and watch my kid be restrained to be able to get like enough blood to do the testing, they had to pass a urinary catheter to get a urine sample. And he was screaming bloody murder the entire time.
Is there equivalent of fear-free for pediatrics?
There is actually. That's a good question. They have all these things that I actually found out about later, like during vaccines, some of your pediatricians will let you like nurse the baby while you're giving the shots. There's these shot blocker things that you put on the skin and it helps like reduce how much it stings when you give it. So there are different things that they try to do to make the visit not as stressful. But just like working with pets in an emergency situation, you don't have sometimes like the time or ability to like take things slow. And when you have to get like blood and urine from a child, you have to just get it done. And so I remember in that moment just being like, this is such a hard job. Like hearing a baby cry to me was very different than hearing an animal bark or whimper. And I was so much more triggered. Now, obviously it was my own kid too, but I think in general, when I hear about kids getting sick or having like really severe illnesses, it affects me like on a much different level than it does with animals. Not that I don't care about animals, I just see it differently. So I don't know how pediatricians or people that work with kids do it, because the mental part of it of, you know, for me, I'm like, I have to get these things done on this pet because I'm trying to save them, right? And I'm sure they think the same way, but it would be a big block for me to actually get it done.
I will say pediatrics only have one species of person to deal with versus multiple.
That is true. So it is definitely tricky. I mean, even dogs versus cats, I think people think like dogs and cats are really similar, but the medications you use can be very different. The sedations you use are very different. Cats, you can't give them half the things you need to give them, so you have to be really creative about how to get medications in them. But that's probably similar to people too, right? And then I started thinking about, you know, yes, they can't talk to you. It's harder to get things probably done on them at a young age, but also the parents. Like, I know that pet owners can be really intense and really difficult, but that's some pet owners. Parents, I think probably most of them are going to be really on when they're at the pediatrician. But I don't know. Maybe I'm wrong. What do you think? You're drinking Mountain Dew instead of doing your job. You have one job to co-host with me.
I mean, I won't be very intense if it was me because I don't have any idea what's going on.
That's
so it
true.
probably depends on what parent it is.
Well, and that's similar at the vet. Like one parent always never has an idea of what's going on. But I think that, you know, you have similarities with like some parents don't want to vaccinate. Pet owners don't want to vaccinate, right? Like some people are going to say like, can't you just give them ibuprofen and not like do the testing and figure out what's going on? Or I know it's strep, just give me the antibiotics. Don't do the test. Like you're going to have very similar personalities when dealing with choices and things that are being
I don't think
made.
I've ever thought about this before, but it is very similar.
It is. I think it's more similar than not, pediatric medicine and veterinary medicine. Now, one other thing that I thought about, which I think is important, is insurance. So obviously in animals, the way insurance works is very different. Pet insurance, usually the owner pays us and then they get reimbursed on the backside. In human medicine, most of the time insurance pays or there's rates, right? And then you pay like a small amount. But also there's might be things that you want to do for a patient that you can't do because insurance says no. We have a friend that they need surgery right now on their child, and they're fighting insurance about the hospitalization afterwards and, you know, how much they will or won't cover for that. So thinking about that, gosh, I'm happy I don't have to deal with human insurance in any way, shape, or form when it comes to like the care of my patients.
Agree.
You used to work in human healthcare.
Mm-hmm.
do you feel like now that you don't technically work as a veterinarian, but do you feel like you prefer the way that veterinary medicine does things, or do you feel like they're both kind of messes? What is your thoughts on that?
No, human medicine is definitely much more of a mess with lack of transparency and the way insurance works than veterinary medicine for sure.
It is shocking to me how another time our kids got hurt. I feel like there's a ton of stories. But Corbin fell off the back of the couch and hit his head when he was young and was really out of it. So I was worried about a concussion, obviously. So I went into the human ER, and the doctor's like, one, didn't do anything other than like shine the light in his eyes, like didn't listen to his heart, didn't feel anything, like barely touched him. And I was like, okay, I guess that's, our exam. And then he said, I want to do I think it was an MRI or CT. I'm honestly at this point don't remember. And I said, great. How much is that? And he looked at me like deer in the headlights. And I know that people have told me before, like they don't know because there's so many insurance companies and rates are so different. But just thinking back to like my job as a veterinarian, I would never be able to say like, hey, I want to take x-rays, and someone just be like, cool, thumbs up. Like I have to do an estimate. I need to at least verbally be able to tell them like how much it's going to be. And so the idea that you can just make recommendations and do things that are thousands of dollars without them knowing that's how much it is or how much it might cost them in the long run was just like,
yeah, the system's
mind-blowing to me. And so the amount of times I've had to talk about finances with a pet owner regarding their patient versus, pediatrics having to talk about the money side of things, I don't think they ever really have to.
Now, the flip side of that is in an emergent situation and you're taking your kid to the ER, you don't worry about it.
Yeah.
You'll figure that out
Down
days later.
Mm-hmm.
So
because there's no other option.
Yeah. I mean, if you bring your pet in, you do have to worry about, not only your pet, but, how am I going to pay for this? Right. So I think maybe there is another level of concern on pets because you do have to worry about the money part up front. In human medicine, you really worry about the payment on the back end.
That's very true. And part of that is because, and this is probably, to me, this is the biggest difference, because pets are owned and considered property and, kids are not, right? There's only so many choices you can make for your kids versus your pets. So as a pet owner, and this happened just recently in the ER, we had a very young puppy come in and had no vaccines, diagnosed with parvo, and this puppy was really poorly doing. And the one owner was devastated, crying, very upset. The other owner was, and you hear people this happening, but it really doesn't happen as much as you said, but basically it was like, well, I know what I'll do. I'll take him home and I'll shoot him. That's what I'll do. And my team was really upset about the fact that he was saying that. And we worked through it. And basically I was like, that's not what you're going to do. That's not as simple as you think it's going to be. And he's like, well, I hunt deer. It's not the same thing. Like trying to, put a puppy down with shooting it versus hunting a deer. But convince him finally to like humanely put the puppy to sleep versus letting it suffer or taking it home and doing that. But in thinking about this question, like that would never be a discussion. Like if a parent refuses to treat their child or to do what they need, that's actually something that like people step in and say like, no, this child needs to get the care and, it gets taken care of. And so I think that's the biggest differences for all the similarities. The biggest difference is the options that you have ultimately with like what you decide to do. And they're trying to change that, actually. There's a state that is trying to make it where pets are not property and pets are considered something else, where one, it would greatly change like if you sued your vet or you sued somebody, like what that looks like. And two, it would change kind of the laws regarding if you do injure a pet or there's animal abuse or something, things would be much stricter because they wouldn't be considered just property. So that's kind of a slippery slope, and that's something that we could talk about another time. But that was the big standout difference to me. For all the similarities between veterinary medicine and pediatric medicine, ultimately with kids, you're going to do absolutely everything you can to save them and for them. And with pets, there is a financial component and there's a decision sometimes that has to be made for what you can do.
I don't know if we answer the question, what's harder?
That's a good point.
I don't think you can answer that question.
I
think they're very different and very the same. So I don't know how you would even...
I would say after being a vet for 16 years, doing a lot of things, working emergency, having to make a lot of difficult choices for pets, I still think pediatric medicine is harder because I think having the option to do absolutely everything and having the component of it being an actual child and being a parent myself, I don't know how people do it. Like losing a child patient versus losing a pet patient. And maybe I'm sure there's veterinarians out there that'll say like, no, I feel as strongly about it, but I can still kind of disassociate and protect myself a little bit when it comes to pet loss. I don't think I could do it as well if it came to an actual person. So I would say pediatric medicine is harder. I would love to hear if any pediatricians have feelings or thoughts on it. But I really, really think that it's an interesting thing when you start to think about it. And there's more similarities than not. So hopefully that would mean that we could support each other in human healthcare and veterinary medicine because we kind of understand what we both have to deal with and what we both have going on. So
what's harder, a human dentist or doing dental as a veterinarian?
A human dentist, for sure. Again, everyone wants their teeth to look like pretty. In vet med, we're like, oh, that's infected. We'll take it out. We're not going to worry about it. No animal cares if their teeth are missing, except working dogs. And then you can actually put in a fake cap or put something in. But definitely a big difference. Okay, what's your take home? Is your take home vet med or pediatric?
I don't know.
You're on the fence?
I'm on the fence.
You think you could do either, or you just wouldn't do either?
I wouldn't do either. That's the easiest question. That's not for me.
It's not happening for you.
No.
All right. Well, if you guys have any additional questions, you can reach out to us on social media at Questions with Crocker. I also was told by Harrison, who helps us with our podcast, that we're going to start having a feature during the podcast where you can actually text questions or text additional things while you're listening to it. I don't know how this works, but that's something that should be coming. If you enjoyed the podcast, make sure to go give us a rating on Spotify and Apple, wherever you listen to your podcast at. Or if you work in pediatric medicine or vet med and you have any opinions or thoughts on the things that we shared, we would love to hear more about it. But hopefully you have a wonderful week, and thanks so much for listening. Thanks so much. Bye.